Do you know that 1 person dies of heart disease in Australia every 12 minutes? Do you also know that oral health, gum disease, is associated with heart disease? And this is due to bacterial infection in the mouth that triggers inflammation that increases the risk of heart disease. Let me introduce you to Joel. Joel is a typical cardiac patient of our system who came with a heart attack and who just completed a rehabilitation program recently. Apart from his cardiac condition, Joel also has gum problems. He's got bleeding and sometimes swollen gums. Yet, Joel has not seen a dentist for more than 3 years. Why is that? The aim of my research and what I did was try to investigate and find out the oral health perception practices and behaviors of patients with heart disease and cardiac care clinicians, as well as the view of cardiac nurses incorporating or including oral health in the cardiac setting, because they are the first point of contact for cardiac patients. By interviewing, by conversations, and also by surveying, I found out, 1, that clinicians have limited knowledge as well as limited resources and training in the area. 2, patients have no idea of the relationship between oral health and heart disease, and they are not receiving any information in the cardiac setting. 3, as Joe, most patients with heart disease are having a lot of oral health problems, and they are not seeing a dentist regularly. So why is that? So the main reason is lack of awareness. In fact, patients that were aware and receive information in the setting, they were 6 times more likely to have seen the dentist in the last 12 months. Both clinicians and patients were happy with nurses promoting oral health in the cardiac setting. So we now need to have a heart-to-mouth conversation when we are, for the first time in Australia, proposing an oral health, a model of care where we train cardiac care clinicians. So when the next Joel comes to the system with a heart problem, he will receive education, he will have an oral health screening, and he will be referred to appropriate oral health services if necessary. Thank you very much.